Hi, my name is John Caulkins. I have had the distinct privilege this year of working with a fantastic set of colleagues on some really fascinating questions related to COVID-19 and economic lockdowns designed to slow the spread of COVID-19 by reducing social interaction, by shutting down portions of the economy. This first of the presentation slides, the list of that fabulous team comes from a variety of institutions. They've been great to work with. This presentation is going to focus on the first of a set of 3 papers to grapple with this question. And in this first paper, the modeling of the lockdown is very simple. It just asks, when should the lockdown start and when should it end? And this work has recently been accepted in +1. I will hopefully briefly get you a sneak preview of the second paper, where we allow the lockdown to be a continuous control variable, adjusting the intensity of the lockdown over time, not just choosing when the lockdown starts and ends. Both of those first 2 papers focus on the time period from when the epidemic starts until a vaccine has arrived and widely deployed. The third paper is really interesting and timely. It's looking at the time window from when the vaccine is approved until it has been deployed to enough people to essentially eliminate the epidemic, i.e., it's addressing the problem that we all face right now. The importance here is really striking. Everybody knows COVID-19 is a health pandemic. It's causing a lot of deaths. It is also a major economic problem. The World Bank estimates that about 175 million people will be pushed below the poverty line this year. And it's important to note that's primarily because of lockdowns and other responses to COVID. It's not the health effects directly that is causing that. And there's a gigantic distributional issue as well, because the infection fatality rate is much, much, much higher for older people than for most younger and working age people. And especially in a developed country context where retirees have a guaranteed fixed income from the government, this creates enormous distributional questions because most of the cost of the economic dislocation is borne by workers. And although there are health benefits for everyone, those health benefits are concentrated disproportionately amongst retirees. If you're uncomfortable thinking about lockdowns as creating a trade-off or balancing between health outcomes and economic outcomes, there are health dimensions to lockdowns. Some of those are good. When you lock down, it reduces the amount of flu. The spring lockdown actually reduced the hydrocarbon emissions enough to reduce deaths from air pollution, but most of the consequences of the lockdown for health are adverse. The delaying of elective procedures, and particularly in sub-Saharan Africa, the diverting of attention and resources away from other valuable health programs like control of malaria and HIV mean that even if you don't want to think about a health economics trade-off, there is a health trade-off that's worth exploring. Now, the backbone of our model is a basic SLIR epidemiological model. Asks for susceptible people who have not yet been infected, I for those who are infected at this moment, R for people who have previously been infected and recovered. The dynamics in this model comes from interactions between people who are susceptible and infected. And in particular, when susceptible bumps into an infected, the susceptible might become infected. And that creates a powerful nonlinear feedback loop, because as some people become infected, that increases the rate and still others become infected. And in the base model, that process can tear through almost the entire population very quickly. We actually have not a 3-state model, but a 4-state model. We have an additional state for people who have been infected but are not yet symptomatic, but that extra doesn't change the intuition very much. The big innovation that we're bringing is not only a balancing of health and econ, but a particular important detail in the modeling of health, which is on the left side of this slide. We focus on deaths. That's reasonable because people most people are not sick for a long time. So most health consequences are death. And we make that death rate a piecewise linear function of the number of people who are infected. Initially, it's just the basic IFR, infection fatality rate. But once there are enough people infected to swamp the hospital capacity, then the slope kicks up to a steeper gradient when, if you need critical care, you're not able to receive it. On the economic side, the right-hand side of the slide here, it's basic Cobb-Douglas production function. We take capital to be constant because the whole thing plays out over only a year or two. And so the driver of economic production, and hence the loss of production, is employment or unemployment governed by the lockdown. The key parameter is this M, which is the cost per premature death due to COVID. Understandably, there's a wide range of parameter values that people argue are appropriate for that. We explore between 10 times GDP per capita and 150 times GDP per capita. But because we measure the units in per day, that translates in the slides that are coming up to M varying between 3,650, i.e. 10 years worth of days of production, and about 55,000. This one figure captures a lot of what's really cool in the results from this model. So let me walk you through it. The vertical axis is the optimal time to end the lockdown as a function on the horizontal axis of the time that the lockdown starts. And in this graph, we're not optimizing that starting time, tau 1, because when we started writing the paper, most countries had already started their lockdowns. And the key thing to look at is the blue line. Initially, if you get the lockdown started pretty quickly, the later that you start the lockdown, that is moving from left to right, the later it should end. The blue line slopes up, and that seems very sensible. If you don't get started quickly, you're going to have to continue the lockdown longer. But then that blue line bends down. And that says that if you don't get the lockdown started until around day 30, then the later you start, moving further from left to right, the earlier you should end the lockdown, which seems quite surprising. And then even more surprising, at this vertical dashed line, there's a discontinuous jump in the blue line indicating that there are two alternative optimal solutions. Here, ending at around day 210, and down here ending at day 90 after only about a month and a half of lockdown. And if you don't get the lockdown started until after day 44, then you should end it around day 90 or 100, to the point that if you don't get started by about day 85, don't bother with the lockdown at all. So what that's saying in an American colloquialism is, at that point, the horse is out of the barn. It's just too late. This epidemic moves so fast, it will have ripped through almost the whole population. But I really want to focus on this discontinuity and these two alternative optimal solutions and point out they are really very, very different solutions. So they're shown on these graphs in terms of the number of people who are infected at any given point in time. With the short lockdown, the number of people infected, the blue line, is actually not that different than the gray line, which would be no lockdown whatsoever. It's just a softening. And then the other interesting thing is that the optimal trajectory for the number of people who are infected bounces back up at the end of the lockdown. So a resurgence in the number of people infected can actually be optimal. Here it's a small resurgence, but with other parameter values, it can be a bigger resurgence. By contrast, when you do the long sustained lockdown, the number of people infected gets knocked down very low, stays very low. Don't worry about this apparent spike up at the end. That's anticipatory of the point where the vaccine is fully available and just says you can reopen the economy just a little bit before the vaccine is deployed. The key thing I want to stress here is the very different vertical scale, may be seen most clearly by the horizontal line indicating hospital capacity. The short lockdown strategy blasts through the hospital capacity and does hit that steep part of the objective function with a higher infection fatality rate because hospitals are swamped, whereas the sustained one does not. In short, these are very, very different optimal strategies. So we then explore this in a little more detail and discover that there are actually 4 different regimes, 4 different kinds of optimal strategies, which are displayed here as a function of that key parameter n, the cost of death. Now, if you don't care much about people dying, then you don't bother locking down. That's no surprise. As n increases, you do a short lockdown, the length indicated by the gap between the blue lines. Then discontinuously, there's a jump, a Skiba threshold, where exactly at that point, there's two optimal solutions. And then when m gets bigger than that, the only optimal thing is a long lockdown, and then another regime change to where the optimal solution is to just lock down always, even from the very first instant. So there are 4 regimes out there, and they span from doing nothing to locking down every single second. And probably for me, the most fascinating result in the whole paper is captured in this slide here. It's a little tricky, but let me walk you through it. This is a plot in 2-dimensional parameter space. The horizontal axis, again, is that cost of a death, and we're varying that from the cost of a COVID death being 10 times GDP per capita, that's the left vertical bar, over to 150 times GDP per capita. The vertical axis, this omega, is what proportion of those who are infected show symptoms. And there's a lot of scientific disagreement about this. I'm sure are aware of this. We know we have good data on the number of confirmed infections, but there's a lot of disagreement about how many other infections are out there that didn't cause symptoms, and so we didn't find out about them. And that amount of uncertainty is indicated by the vertical range here. The whole box is a range within which the world might be. Anything inside that box is a potentially plausible set of parameter values depending on your values and how you interpret scientific evidence. And the key point is that box spans all 4 strategy regions. Down here in the lower left, the optimal strategy is to do low lockdown. Here it's short lockdown. Here it's long lockdown. Here it's constant lockdown. This means that 2 people who agree on the exact same epidemic equations, who agree on almost all of the parameters, and who only disagree on these 2 parameters about which there can be legitimate disagreement, can conclude that radically different strategies are optimal. And that's the conclusion. That's sort of the fundamental policy conclusion of this first paper is it is okay to disagree on what policy is optimal. And you shouldn't assume that somebody who is advocating for different policy doesn't understand science or is up to no good. So we suggest maybe a little more humility could be in order. I think I have like 1 minute left, so a really super quick preview of that paper number 2, where we allow the lockdown to vary continuously. Here, the vertical axis is the number of people who are working. So dips below 1 indicate the strength of the lockdown. So we have only a brief lockdown, a double lockdown, and a sustained lockdown. Those produce very different experiences for society. The bottom graphs indicate the health costs and the economic costs. If you do a brief lockdown, there is a massive health cost, but little economic cost. That society experiences COVID as a health crisis. Over on the right-hand side, it's the opposite. There's very low health costs because few people get infected, but massive economic costs. So that society would experience COVID as a big economic dislocation. And then there's in between. And the point here is that all 3 of those strategies are alternative optimal strategies for the exact same equations and the exact same set of parameter values. And we can do the same kind of bifurcation analysis and find not only standard Skiba points, but so-called triple Skiba points. That is initial conditions and sets of parameter values from which 3 alternative optimal solutions, 3 very different solutions, perform equally. So I will wrap up just by saying that not only has it been a privilege to work with this particular group, I think the problem itself is one that it's a privilege to work on. This is complex in the sense of being hard to work on, and it's complex in the sense of eliciting some fascinating nonlinear behavior. And that emerges naturally just from an effort to build a model that's helpful to policymakers. And you get these wonderful, complex mathematical puzzles that have been a delight to explore this last year. Thank you for your attention.